Correct tab. All right. Hello, everyone, and welcome. I hope everyone's day is going really well. And I see that we have some new folks that haven't attended office hours before and some folks that have. So welcome or welcome back. We're really excited to have all of you here today. Office hours is our monthly meeting where we come together with behavioral health providers and talk about the technology updates that we are embarking on as the Behavioral Health Administration. So if you haven't attended one of these sessions before, we use about the first half hour to go through some technology updates, and we try to update our agenda and send out emails beforehand so you know what topics we're covering. This week, we're going to be covering some updates on our client care search, the artist formerly known as bed tracking and referrals. We're going to hand it over to my colleague Bianca, who's going to give us a little bit of a preview of some changes to OwnPath. And then finally, we'll have some folks talk with us from the Behavioral Health Claims and Eligibility Project. And then we use the second half hour to talk about some community discussion and open the floor to you all. Either if you have questions for our team on any and all things technology, and sometimes we bring community prompts. So we have a community prompt today around the BHA story and how you all think that the BHA story should be told. So
Hey,
again, have a
Abigail.
jam-packed. Yep.
I don't know if maybe it's just my screen, but it kind of looks like the PowerPoint. There's some gray on the right of it. I don't know if other people are seeing that, but that's what I'm seeing.
Let me try my screen share again and see. Is this any better, Amanda?
Yes, that's better.
Okay.
Thank you.
Thanks for letting me know. Yeah, absolutely. And we're a very conversational group, so we'll pause for questions after each of the sections up on the technology updates in case you have questions about that particular content. But we welcome questions all the way throughout the day today. And if the question doesn't relate to one of the topics we're talking about, we'll hold until we get to that community discussion portion and talk about those then. So with that, I'm going to launch us into the first section of this content, which is my section, giving a little bit of an update on some items related to the client care search. So a little bit of background here, if you haven't heard me talk about this particular initiative, we are currently at the BHA building a product with a very long legislated name called Capacity Tracking and Bed Management System. And we are nearing the ability to be able to say that a new name for the tool might be Client Care Search, although that's not 100% official yet, but we'll have a better name than that long acronym because we seek to use plain language. And we're preparing for a launch of this initial tool in the summer of 2024. And if you've heard me talk about this tool before, a couple of things that this tool will allow providers to do is to track their accurate care capacity, their beds and slots, which will ultimately allow us to better facilitate referrals and placement processes in a system and a process we know that is very disparate today. And we also have plans that in future iterations of this tool, we might add things such as like outpatient care and other social care services. Although for the start of this tool in the summer of 2024, we'll be focused on inpatient and residential care capacity. If you want to read about any and all of the research that we've done on this particular product, all these links are here in the slide, and we'll be sending the slides to you after the call today. And these are also all currently up on the BHA's website. So if you're curious about how we came to this product and all the history and the co-creation that we've done with providers, please take a minute to take a look through some of these artifacts because there will likely be lots of good answers there for you. But we wanted to talk a little bit about an opportunity that we have to provide some feedback on this tool. We conduct regular user testing with providers on the build of this new system in order to stay true to our values of co-creation. And we'll also continue that testing pattern post-launch. And just like the research, you can read the results of this user testing completed to date. These are all also on our website. And we have a small request, which is why we're presenting out at office hours today. We have a short survey. It should take you less than 2 minutes, currently open for some design feedback specifically on the directory feature for this tool. So one of my colleagues will be able to put that link in chat. And we hope that you take a couple of minutes just from your positionality as behavioral health providers about how you would like that directory to be designed with an eye towards care coordination. So my folks will drop that in chat. And I'll pause and see if there's any community questions on this particular piece before we move on to Bianca, who will be talking to us about OwnPath. All right. Well, I'm going to hand it over to Bianca, Bianca, do you want to screen share your slides as well, or do you just want to screen share with the demo?
I'll screen share the slides if that works.
Works great. Go for it.
All right. So excited to be here. Let's get the slideshow going. Can folks hear me all right? See me all right?
Yes.
Okay. Excellent. Well, hi everyone. I'm so glad to be with you here today. My name is Bianca Frazier. I use she, her pronouns, and I work on the same technology team at BHA as Abigail, but I'm on a team that works on a different tool, a tool called OwnPath. So I'm here today because our team would love to build a relationship with this group, with providers. We want to get to know this community better, what you care about, what your concerns are, and how you're working with technology and BHA. So in the future, we even hope to hear your feedback and get your consultation on this tool, OwnPath. So that leads to the natural question, what is OwnPath? And that is great if you're not familiar. So I'm actually curious if you're willing, if you're able to put your answer in the chat. Are you familiar with OwnPath? Have you ever heard of this website? Have you ever visited it? And again, no is a great answer. That's why I'm here to chat with you all today about it. And I will be taking you on a tour of this website in just a moment, but I'm excited. I see answers coming in the chat. So I'd like to give you a little bit of background about OwnPath. In 2022, BHA launched OwnPath as a new care directory. The goal is for OwnPath to provide individuals with a resource to begin their own path to wellness, no matter where they're at in their own journey. So what is it? OwnPath is a searchable online directory that allows people to find behavioral health providers that are licensed by BHA and to search for specific services or use a guided search to identify the providers and resources that best meet their needs. So one really neat thing about OwnPath is that searches can be narrowed by criteria such as your location, the days of operation that you're hoping to find, the language support that you need, the payment types that a provider accepts, and other filter criteria. So again, the goal of OwnPath is to give people in Colorado seeking behavioral health care an accessible, transparent experience and help them meet their needs if they're looking for services for themselves or a loved one. So this is a good moment to clarify that when this tool was built, the primary audience was people who are seeking care, not necessarily this group, folks who are providing care. But we've learned through some early conversations with providers that providers are using this tool, sometimes as a way to see like who else is in the community. And other times, maybe you're curious if you have a patient who you can't serve in a certain way, you want to see who else is out there and might be able to, you can connect that patient to get their needs met. So with that said, I'm going to actually pull up this website and show it to you live, to show you around how it looks. So this will take me a second to switch the screen share. Um, I could do it, believe in me. Um, okay, so we're gonna share own path. Excellent. Thank you for your patience. So Amanda, can you confirm, are we seeing own path right now?
Yes.
Excellent. Thank you. Thank you, Amanda. So welcome to OwnPath. This is the home page. One of the things I want to highlight for you right away in the top right corner is that you can switch the language and you can see OwnPath in Spanish. So that's a feature that I know I'm really excited about. I'm going to switch it back to English. And so there's lots of different ways to begin searching for the kind of care you need. I'm going to start by plugging in a zip code here. So I'm going to plug in a zip code, and then there's a feature where you can hold down this little menu and pick what you're specifically looking for. So today I'm going to choose mental health in my zip code and click search. So this is really exciting. This is going to pull up a list of options that are near me. I can see on a map kind of what's in my area. I can also, across the top, here's where I can filter for some different things that I might be looking for, whether that's distance, maybe a specific age that a provider serves, a population that a provider might specialize in serving, language services, payment types. We know that this is critical. People want to understand, what kind of payment a provider accepts, the days that they're open, some accessibility features, and also telehealth. So today I'm going to look at Paragon Behavioral Health Connections. I can see they're accepting new patients. They have telehealth. They're 5 miles away from me. And down across the bottom, I can also see the types of payments that they accept. I will also say there's a compare provider feature, which might be neat if you want to compare some providers. But I'm going to go ahead and click on Paragon. So now I'm looking at a profile for this specific provider, and I can still see them on the map. And if I click here, it'll pull it up in Google Maps so I could get directions right away, some of those contact details. And we know from early conversations we've had about OwnPath that a place users want to go really quickly is a provider's website. So they've gotten some of these basic details, this provider meets their needs, and they want to jump pretty quick to a provider's website. So we have that for them. And scrolling down, there's some other exciting details such as services. I can also see some of those details, accessibility information, languages spoken, populations this clinic serves, telehealth options. And all of this I want to highlight again, as I'm headed to the top right of the screen, I could actually find all of this in Spanish as well. I'm going to pull that back to English. All right, so thank you for journeying through OwnPath with me. I'm going to take us back to the slideshow and let you know what our team is working on these days. All right. So now that you've met the team, you've met OwnPath, I want to tell you a little bit about what we're working on. So actively, we're thinking about how OwnPath is going to display new licensing information. We're also working on adding additional information to OwnPath so that providers can share more about what makes them unique. And lastly, we're really excited. We're working on a way for providers to update their profiles themselves. So that last page we were looking at for Paragon Behavioral Health, that profile page, a way for a provider to, go change their address. Maybe you're open on Saturdays now, you could update that information. We want to help you help clients find, we want to help you find the right clients for your business and help you have more control over how you appear on OwnPath. So we think this is really exciting. And some of the providers we've had really early conversations with, these are some of the reasons that they're excited that they could have more control over what their own path profile looks like. Again, this ability to highlight features that make your clinic distinct, things that you're excited about, that make you unique in your community. For a lot of providers, your clinic information is changing. Maybe you're moving buildings or you're open on your hours change. Having ways to update your profile yourself, you could go change that information really quickly. And then lastly, this is a free online presence that can help new clients find you and help others in the community, see that you're in the community. So we don't have any active research projects going on right now, but we're here to, start that relationship with this provider community. We'd love to have you stay involved. We plan to be here at these provider office hours and share when feedback opportunities come up. Here's an email if you want to, right away you want to get involved or you have some immediate feedback for us. And I will drop this email in the chat as well, but we're really excited to keep coming to these office hours, build a relationship with the providers, and keep improving OwnPath to meet your needs. All right, so thank you so much for having me. And Abigail, I will pass the mic back to you.
Yeah, and before we move on too far, thank you so much, Bianca. Does anybody have any questions for Bianca on OwnPath or any of the topics she presented on? Either in chat or coming to voice, either of those is great.
This is Tamara from North Range. Is OwnPath able to still take things from ladders and pull it over into there?
Yes, Tamara, great question. Thanks for asking that. That's the information that is displayed on OwnPath right now is coming from ladders. Did that answer your question?
That did, thank you.
Awesome.
I guess I do have a second one. I'm also
Wonderful.
familiar with OwnPath as the learning management system. Is that two different things or is that all another part of this? Or is that all one thing?
That's a great question. This is the care directory. You are totally correct, though, to mention OwnPath as the learning management system. I would say that OwnPath is kind of the umbrella term for these resources that are available. And I'm not sure if anyone else from BHA wants to weigh in on that to kind of help understand how these tools are both branded as OwnPath, but different.
Yeah, I don't know if, oh, Alex, you came off. So maybe I'll hand it over to you.
Yeah, hey everyone, my name is Alex Orlov, and I have the pleasure of working with both Abigail and Bianca here at BHA. And yes, the OwnPath Learning Hub is a new tool from the BHA. And what BHA is moving forward with is using OwnPath again as an umbrella. You might call it a brand for our more publicly available technology tools, as opposed to some of the tools that Abigail and her team are working on, which are, not publicly available, only for providers themselves.
Thank you.
You got it.
Yeah, and I think that that's a great, so we're trying to do more of these like interactive demos of our technology kind of week over week. So I think that's honestly a great idea for maybe next month we can have that team come and give us a similar demo to the way that Bianca did. And that way we can kind of start to see the connections between these different pieces. Because I just want to reiterate one of the things that Bianca said, like really our goal right now is we're in a foundational building phase where we're looking at all of the technology that exists and understanding what our providers need and what people seeking care need. And so we're building that foundation, and that foundation is made up of several different technology systems. But I think, as some of y'all might know who are maybe on the techier side of things, interoperability between those systems is really what's going to make for those best practices in terms of your experience as experiencing kind of BHA as like a centralized place to get all of your technology needs done in the way that you need to interact with the state behavioral health administration. So we're building that foundation together, and love to take time like this to go over kind of like individual products. All right. Well, folks can always mull and ask questions later, but if we're not seeing any questions in chat, although I did just hear, I want to come to voice on a question that Bianca answered in the Q&A. Mary asked a really good question: who do I contact if my office hours are stated incorrectly? And so Bianca provided that OwnPath email, and so that will be the process so far today at this point in time. If there's incorrect information, it could be routed to that email address. So just wanted to bring that to voice. All right. So we have one more technology update, and I'm going to hand that over to Justin Mann, who's going to talk us through a couple of updates on the Behavioral Health Claims and Eligibility Project.
Hey, folks. For those of you who don't know me, I am Justin Mann. I use he, him pronouns. I'm a senior technology advisor here for the BHA, and I work closely with the team over at HCPF on the Colorado Interchange and MMIS. You may have heard this called the BHC&E project, the Interchange project, and various other things in between. We've had a few questions over the last few months about when and do I need to integrate with the Interchange. Stephen Peng sent out a memo to clarify this, I believe, last week. I'm going to run through these things just to double clarify, and then I'm here to answer any questions that you might have or get them to the right people so that we can add additional clarification. So, do providers need to integrate with the Interchange? The short version is only BASOs will need to integrate for data reporting. So from a technology build perspective, the only people who will be actively doing technology integrations with the Interchange will be the BASOs. All providers will need to register one time with the Interchange so that we have an ID in the system, so that when your encounters are ultimately submitted to us, we know who you are. If you are a Medicaid provider, you may not need to register because you are probably already in the system. Information on that will come out as we get closer to the BASO rollout. It will be part of it's expected to be part of your part of the process where BASOs are building their network of providers. So as you're contracting with BASOs, this should be part of the process. Next slide, please, Abigail. So what specifically, what does that mean? Between now and through FY25, so until June 30th of 2025, keep doing what you're doing. If you're a CMHC or other BHA direct service provider, keep submitting your encounter data through the CCAR system. We encourage you to enroll in Peak Pro training and get the training now so that you can start getting used to that system, because you will need it later. If you're an ASO or an MSO, continue to submit encounter data through the CCAR system or whatever process you have historically established. Again, keep doing what you're doing. If you're an intermediary, you're encouraged but not required to enroll in the Interchange as a provider. We can talk. If you are an intermediary and you want to know what that means, please reach out to me. But you're not required to enroll at this moment in time. You are, however, encouraged to enroll in Peak Pro and sign up for the training. And if you are an ASO or an MSO, you're recommended to encourage your provider network to enroll in Peak Pro and receive Peak Pro training. Again, because you will eventually need that in FY26, it will be a requirement for then. And so getting you up and running sooner is better. Elizabeth, an intermediate, if you don't know what an intermediary is, you're not an intermediary. But these are people who are submitting things on behalf of other people. And so, if that is not your specific business, then that you don't have to worry about that. If you'd like more details on that, reach out to me. You have my email address, and we can dive into the specifics of who that is. But it's a very small number of people. Next slide, please, Abigail. Starting July 1st of 2025, TLDR, talk to your BASO. Encounters will be submitted to your BASO, and your BASO will submit them to the interchange. CMHCs and BHA direct service providers will update their interchange enrollment to associate themselves with their BASO. All your service encounter and claim submissions will be submitted to the BASO. The BASO will do data validation, quality assurance, data analysis for their network, and then they will submit encounters to us on behalf of their entire network. Starting in July 1 of 2025, so for fiscal year 26, CMHCs and BHA direct service providers will be required to use Peak Pro to verify Medicaid eligibility prior for all individuals served, help process Medicaid applications if necessary, or request your statewide ID number, your statewide ID number in case that is an appropriate thing for you to do, which is primarily a crisis services scenario, or if your client for some reason does not or will not engage in a Medicaid process for various reasons. Mary, BASO stands for the Behavioral Health Administration Service Organization. This will be the new replacement for ASOs and MSOs that is rolling out in next fiscal year. Next fiscal year. CCAR and day codes. So CCAR and day codes will continue to be submitted in the way that they are currently submitted. This is just the encounters. So these are the 837P encounters, not the CCAR day codes. This is for the individual services, not the assessment that is at admit discharge 1 year. Forgive me if I said that poorly, but it's just this is just the encounters. Next slide, please, Abigail. So if you're an ASO or MSO, again, summary, talk to your BASO. ASOs, or you if you are an ASO or an MSO and you are responding to the RFP, maybe you will become a BASO. But the ASO and MSO functions will transition to BASOs. BASOs will be required to enroll and do the technology integration with the interchange as a BHA provider. All your subcontracted providers within your BASO provider network will be required to enroll, but there is no technology integration for them. It is a registration and enrollment. If they are already enrolled in Medicaid, they do not need to enroll a second time. But they will need to associate their enrollment with the BASO. Same disclaimer, all BASO subcontracted providers will be required to use Peak Pro in order to verify Medicaid eligibility for all individuals served and assist with processing Medicaid applications or enrollment into BHA services as part of your contract. So get training now. It'll save you during crunch time later. Question from Wendy. If you're currently verifying Medicaid through 270, 271 requests to the HCPF site, does that need to start going through Peak Pro? Wendy, no, it does not. However, you can continue to use that process for Medicaid enrollment. However, there are going to be two status codes for BHA services, which are means tested or non-means tested. Some of the funding that the BHA provides does require a means tested, is only for people who are means tested or in priority populations. That you will not at this moment in time be able to get from a 270, 271 response from the Medicaid system, and you would need to check that in Peak Pro. That is something that we are actively considering and trying to figure out. We had some bumps in the road with Medicaid providers incorrectly billing the BHA, which does not pay Medicaid claims. So we have to figure that out before we bring that back. But you can continue to verify Medicaid through 270, 271. But if you are needing to verify non-Medicaid status, then you would have to do that in Peak Pro. Does that make sense, Wendy? While Wendy's processing my very poor explanation of that, Abigail, can you move to the next slide? All right, and apparently I'm done. Wendy, again, we are. It is on the wish list. We just need to figure out how to properly message the BHA status. Unfortunately, we currently you can check the BHA the BHA status via a 270, 271 response to the MMIS. That is being removed in 7 days because we have unfortunately had a couple of situations where people incorrectly assumed that someone's BHA status was equivalent to a Medicaid eligibility, and therefore they incorrectly assumed that someone had benefits coverage through Medicaid, even though they explicitly do not have that coverage. And so we need to clarify how to properly send that 270, 271 response without people thinking that it is a Medicaid eligibility, which is mostly a usability issue, not a technical problem. We have solved the technical problem. It's just we need to figure out the usability side of things. So our goal is, yes, that you will be able to use your 270, 271 and your EHR integrations in order to check eligibility for both Medicaid and BHA options. We just need to figure out the very specific implementation of that. And I think
Thanks, Justin. So we have wrapped up. That was the last content piece that we have for you today. So we have a short activity, but before we do that activity together, I want to open it up for open Q&A and discussion. So open to questions about topics we talked about. Again, we talked about the client care search. We talked a little bit about OwnPath, and Justin gave us a bit of an update on behavioral health claims and eligibility. But anything's on the table. So we'll take a couple of minutes and see if folks have any community discussion questions that have come up that you would like to talk to the BHA technology team about. Okay. Just so you know, we have a rule that Janelle, our deputy director, likes to talk about, that we wait 8 seconds of silence to make sure that people have fully had a time to process and think if they have any questions. So that was our 8 seconds. Please, if you happen to have questions after we've gone through the activity, come off voice, come on chat. All of those are good options. But to wrap us up today, we have a little bit of an activity. And like I said, this activity is around community storytelling. So I'm going to hand it back to Bianca to just walk us through this quick activity that we can use to close us out.
Awesome. Thanks, Abigail, and thank you, providers, for having me twice today. So in addition to OwnPath, but completely separate from that, I'm attached to another project where BHA is trying to think about how different groups experience BHA, what it is, what it does. And so we wanted to bring this to such an important group, providers, and ask you, what are the three words that come to mind that you might use to describe BHA? So again, thinking about BHA, what it is, what it does, and if you were going to explain that to a friend or a neighbor, so kind of casually, what would you do and what words might you choose? So here there's no right answers, there's no wrong answers. This is just sort of how you experience BHA, how you think about it, what it is, what it does. We have some example words here. I like how Abigail did that 8 seconds. Let's take those 8 seconds, and then we welcome you to, anyone who's willing to share your three words in the chat. But I'll pause for 8 seconds and give folks a minute to think about some words that you might use to describe BHA. Awesome. So yes, Abigail's emphasizing no wrong answer. We love honesty. Some examples that, from the example section, both inefficient and efficient, trustworthy, misleading. Like, this is really open, whatever your experience is of BHA. Yeah, so I welcome you to put that in the chat. And then, Mary, if you'd like to come off mute.
Okay.
Yeah, I'd love to hear from you.
So I'm a first-time person coming, and I kind of chimed in for the wrong reason, but I'm glad I'm here. It's because I heard some other pieces of information that I'm going to take advantage of, so I can now be on the cutting edge during the time it's happening instead of after the fact. And so what I would say, BHA is regulatory. I work with young people sometimes in my secular life, and so they're the boss, they're the top dogs. They're formerly OBH, and I speak and I say, okay, OBH is now BHA. So you guys, you regulate, and it's needful, and you're the government entity that oversees, from my understanding, public safety and public health, behavior health. I would also say that BHA is accountable. You're the part of the government. There has to be some accountability there, and we need to know who's who in the zoo, so to speak. And then impactful, because right now I am in the driver's seat trying to figure out how to write policies. My boss died a year ago, and so I have all this stuff going on. And I'm just glad to be here. I wrote down, I have some notes that I'm going to rely on, and you guys will see me again, because in my mind, it needs to make sense. And once I can connect the dots, then I can teach this and share with the world, because I'm good at that. That's all I have to say. Thank you.
Mary, that was fantastic. Thank you so much for sharing your perspective. Yeah, I heard accountable, top dog, who they used to be OBH. Excellent. And I see some things coming through the Q&A and the chat. I might recommend, if you can put your three words in the chat, that would be useful. I see some anonymous, and actually that's really lovely. Anonymous responses coming through in the Q&A. Knowledgeable, regulatory, bureaucratic, absolutely passionate, under-resourced, undefined. Yep. Unresponsive, disorganized, friendly. Okay, three words. Really appreciate folks sharing those. Yeah, we do love anonymous. And if anyone else would like to come off mute. Yeah, I appreciate, I think the Q&A responses, that's allowing people to be anonymous. So if you'd like to share your thoughts, your three words anonymously, that makes a lot of sense. We absolutely welcome that.
And Bianca, I wonder, because we've been getting some pings in the anonymous Q&A, I wonder if we might want to send out like a survey in our follow-up note that maybe people could fill out anonymously if they don't feel comfortable today.
That's a fantastic idea. We'll absolutely do that.
Awesome. Fabulous. Thank you so much, Bianca. And thank you everybody who shared. We love hearing those stories, good, bad, or otherwise, because it really helps us to understand from a realistic and honest perspective what we could be doing better and what our current perceptions are of the administration and the technology and the services that we provide. So thank you for your honesty. We really, really appreciate it. No conversation can kind of start without that foundation. So appreciate all of you so much. All right. Well, we are out of topics. And so our office hours tradition is that when kind of the chat slows down, if people don't have as many questions, the BHA technology team will stay on the call, but we invite folks to leave if they want some extra time in their day. But otherwise, we will be staying on here until the last person leaves, answering questions, and we'll keep the recording going just for parity and equity of information. So feel free to go on your day or stay and continue to chat with us, but we appreciate your time, and we'll be following up with the slides, the recording, and the notes from today to all of you.
I have a follow-up question for Justin. I actually already sent you an email, I don't know, maybe 2 weeks ago, but I was hoping you could just explain really briefly what an intermediary is, because I think that the other portion of my business may be an intermediary, and I just want to double check that I know what the definition is.
Okay. Yes, sorry, I was trying to come off mute there. Let me get you the official answer from Stephen, because I don't want to lie to you.
All right,
but
thank you.
I am pretty sure that it boils down to so we have various organizations, and apologies that I'm going to butcher this and I don't have specific clarity for you. We have various organizations that collect data, clean it up, and then submit it on behalf of smaller or other organizations that don't want to be dealing with the specifics of our data formats and things like that. So they're just companies that sit in between providers and us.
Got it. So they're like a third-party vendor that takes all the data, puts it in the format it needs to be, and then submits it on behalf of the provider.
Yes, but I want to confirm the definition for you, especially if it's going to affect how you approach things. But the reality is that if you are not a BASO, if you do not end up as a BASO, you will not need to integrate with the interchange. If you intend to go for the BASO contract and you want to get a head start, then you can do the integration now. If you want to get engaged and make sure that your organization, even if you're not going for to be a BASO, if you want to make sure that your organization is collecting the right data in its workflows so that you can send that data to the BASO and it's all there, and you want to get ahead of the curve that way, get in touch and we can talk about that. But basically, between now and when BASOs are selected, there's no requirement to do anything for anyone unless you want to, for whatever reason, get enrolled in, integrated with, or experience with the MMIS interchange system.
Yeah, I think we're going to wait until the BHA winners are announced, and then we'll know how we're going to move forward from that. I think I just had in my brain that possibly a portion of Carillon on behalf of the Rays that maybe we do something with the raise data. And I was trying to figure
So
out if that is the intermediary definition, because that would
so
impact what we're doing.
yeah, this is completely separate from the raise and ACC 3.0 and all of
Oh,
that.
good. Okay.
The Medicaid stuff is a completely different beast. That
Okay.
you know,
Perfect.
yeah.
Is it sad
It's
when I say that's perfect? That's
yeah.
the best answer you could give me, because then it means I don't need to worry about it, which I
Yeah.
love.
Yeah. I mean, hey, look, if I can make you less worried by adding bureaucracy and complexity onto the system,
Yeah. Thank
great.
you.
Anytime.
Oh,
Yeah, so part of our goal here is to reduce the administrative overhead, because we do know that a large number of our organizations are both Medicaid and BHA funded
right.
organizations. And part of the original thesis of this project was, if most of our providers are Medicaid providers as well, and they've already had to integrate with this system for Medicaid billing, is it possible to reduce the overhead in the long run by reducing the number of systems that they have to integrate with, and the formats that they have to send data in, and et cetera, et cetera. So um, we
Well,
did
that's
want to
perfect.
make things easier for you.
Thank you. I really appreciate that.
We're trying. We are.
Yep. You're doing good.
Any other questions?
I'm muted. Last call for questions. Sometimes folks leave their cameras on for recording. So one final call in case anybody has final questions, and then we'll probably turn the recording off and close out. All right. Thanks, everyone.
Thank you. Bye.
Bye, Elizabeth. Bye, everyone.